radionucleotide agents. So we're going to see radionucleotide agents along with their uses. So to ask a few questions, what is what is the use of the TC99M technetium RC2-MOMBAP? Second question, what is the use of the TC99 disophenin? Third is, what is the use of what are used in case of the renal imaging? What are the radionucleotide agents used? So by the end of the video, you will know the answers to all these questions. And in the end of the video, there are some questions to be answered in the comments as well. So to get started, firstly, we are looking at the TC99M. It is medronate. It is known as the MDP. Next, along with as well as the TC99M, that is oxydronate. Okay, medronate, oxydronate, and along with the TC99M, that is a HEDP. So all this are used for the bone imaging. So what is used in bone imaging? It is a medronate. Medronate is most commonly used, and also the oxydronate and the HEDP. Next, we move on to the TC99M, abscitide. So abscitide is used in case of the peptide image. So peptide image of the DVT. And after this, what we see is there is the TC99M RT RC2-MOMAP. So in case of RC2-MOMAP, it is used in case of the monoclonal antibody, and this is for the colorectal cancer. So then we have the TC99M. So TC99M, that is the albumin colloid. So TC99M albumin colloid, it is used for the imaging of the RES, and that is the liver and the spleen. Next, what we see is the TC99M biochemistry. This is nothing but the ECD. Then we also have the TC99M. This is the hexametazine. So both of them, they are used in case of the cerebral perfusion imaging. So what is used in cerebral perfusion imaging? It is nothing but the bicysate and the hexametazine. Next, we move on to the TC99M. This is nothing but the depriotide. So depriotide, where it is used? It is used in the somatostatin receptor. And also there is the bearing of the pulmonary masses. Then we look at the TC99 disophenin. So it is nothing but the Decida. So it is used in case of the hepatobiliary imaging. So TC99M disophenin, that is the Decida, is used in case of the hepatobiliary imaging. Next, we look at a group. It is TC99M glucepitate. Then TC99M mariatide and TC99M succimer, that is a DMSA. So all three of them, they are used in case of the renal imaging. Then we look at the TC99M, that is the human serum albumin. So this human serum albumin is used in case of imaging the cardiac chambers. And then we look at the TC99M, that is a lidofenin. Lidofenin, also known as a HIDA. Then we have the TC99M mebrofenin. Mebrofenin. So mebrofenin and lidofenin, they both are used in case of the hepatobiliary imaging. Next, we look at the TC99M. This is the nofetumomab. So the nofetumomab or the merpentan NRLU10. So this is used in case of the monoclonal antibody. So it is used in case of the monoclonal antibody. FAB fragment. This is used for the imaging of the small lung cancer. Imaging of the small lung cancer. Next, what we see is the TC99M. This is the pentatate, that is DTPA. So this pentatate, it is used in case of the renal imaging, as well as in case of the functional studies. It is also used in case of the radio aerosol ventilation imaging. Next, we move on to the TC99M pyrophosphate. So TC99M pyrophosphate. So here what we see is there is avid infarct imaging. Avid infarct imaging. And then we move on to the TC99M. This is the RBC. So here it is used in case of the GI bleeds as well as for the cardiac chambers. Then we look at the TC99M sestamib. So TC99M sestamib, it is used in case of the myocardial perfusion imaging, and it is also used in case of the breast tumor imaging and the parathyroid gland. Then we look at the TC99M. This is the sulfur colloid. So the sulfur colloid is used in case of the imaging of the RES, that is the liver and the spleen, and also the gastric emptying and the GI bleeds as well. Then we have the TC99M, that is a tibaroxime. So tibaroxime as well as the TC99M, that is a tetrafosmin. So both of them, they are used in case of the myocardial perfusion imaging. Next, we look at the gallium. So the gallium is used in case of, it binds to the somatostatin receptors, binds to the somatostatin receptor, and also it is used for detection. It is used for the detection of new neuroendocrine tumors. So this is about the radionucleotide agents and their uses. So now we'll be answering our questions. So the first question we asked was, what is the TC99M R-citumomab? So the TC99M arcetumomab is used for the monoclonal antibody for the colorectal cancer. Next question was, what is the TC99 disophenin? So it is nothing but the disida. And this is used in case of the hepatobiliary imaging. Hepatobiliary imaging. Next, we also have the renal image. So the renal imaging is done by the TC99M, that is a glucipeptide. Glucipeptide, also the TC99M meriatide. To repeat, the renal imaging was done by the glucipeptide as well as the meriatide. Then there is also TC99M succimer, that is a DMSA. And there is also the TC99M pentatate, which can be used for the renal imaging. So now a few questions to be answered in the comments. So the first question is, what is the use of the TC99M, that is a pyrophosphate? So all these videos, all these answers are maybe found in the video as well. So TC99M, where it is used, pyrophosphate. Second question is, in case of the myocardial perfusion image. So in case of myocardial perfusion image, what is the radionucleotide used? What is used? So the last question we want to be asked in the comments is the TC99M, that is the human serum albumin.